This study was called Supporting Mental Health Recovery Within a Public Library Context. It was a project conducted with myself out of the School of Nursing at Western University, and I had a really cool opportunity to partner with media studies as well as library sciences. So in terms of the background of this work, mental health care in Canada has long been focused on community-oriented care with hospitalization only as necessary. That's important. It's been determined by the courts that people have the right to the least restrictive care, the right to live in the community. However, there has been a lot of complications with delivering this model over the decades. And one of the main complications is that many of the folks who have the most sort of complex lives in terms of social conditions, such as poverty, homelessness, being refugees, having limited language comprehension in English, are the same individuals who are then going to have trouble getting access to mental health services as well as to just general primary care. And so in this context, we know that there are a lot of gaps within our current mental health system. Additionally, public libraries at this time are evolving their services to be broader supports to the community in many, many different ways beyond the traditional books or more recently access to the internet. And so this has included embedding various social services into their spaces. So a local public library, a large urban library, had recently allowed a community mental health organization to set up a help desk, which later grew into a full, what we would call a hub, to provide mental health support in the community. So we came in to evaluate this and to really ask questions about, well, how does this fit within the library context? And what does this mean in terms of access for individuals to mental health supports? And how do the staff of the library even feel about this? Is this bringing a lot of sort of work into their space that they're not prepared to support? So to do this evaluation, we did a mixed methods approach where we both interviewed people as well as we handed out a survey. So we interviewed people who were accessing the hub. We interviewed the hub staff as well as the broader library staff. We did 25 interviews and we distributed and collected 25 surveys with just library patrons. The surveys were just basic questions around satisfaction with the hub and whether they would refer others to that service. Not surprisingly, all of those scales were rated on a 7-point Likert scale, 6 or higher. So in terms of talking to the staff and the patrons, in the qualitative findings is where we found things that were more dynamic and interesting than just the survey results saying this is a good service. So the first thing we heard a lot about is that this service doesn't stand alone, but is situated within a community where many people use the idea of a mental health crisis. And when they spoke to that, what they're speaking to is this sort of imbalance between the level of need and the availability of support. And in that way, having this desk that was easy to access and very visible allowed people to not just get immediate help with having someone to talk to when they were in need, but also to find a pathway to referral for other services. And so there was a strong feeling of a fit from both the staff and from the patrons. Secondly, in terms of staff, I was curious to see if they were going to be concerned that this was maybe bringing a lot of people who were now seeking help into the library space who might not have been coming in before and actually making their work more difficult. However, we heard quite the opposite. For the staff, they really appreciated having mental health professionals in their space to provide consultation. So if they had a patron who maybe wasn't accessing the hub, but was in a crisis, maybe even on a different floor, a different area of the library, they became very comfortable in going to the hub staff and asking for their help and their assistance. And having that expertise in-house really prevented a lot of what I would say would be unnecessary or extra use of security staff or even things like police and paramedics. And so in a way, this was providing also a diversion from more intensive types of service and care. The third thing that we learned from this study is the importance of the relational support that's provided in this type of model. A lot of our healthcare services now, not just mental health care, but healthcare services in general, are sort of virtual contact or referral services. So you might be calling a crisis line, or maybe if you've got access to a computer, doing a Zoom with like a crisis counselor, which is an important piece of the system. But we know through our expertise in mental health services that relationship is very, very important in mental health care. And what was important for the hub, for many of the patrons, was that it was a place where they could come back to again and again as much as they needed to talk to the same individuals. And in that case, relationships were developed over time that really allowed the hub mental health staff to use their expertise to understand the particular needs of particular patrons. And so by having that physical space with people, it provided something additional to the often sort of virtual care provision that people experience in the community now. So overall, our analysis was very positive about this model. And as I mentioned at the opening of the video, the organization has increased and made permanent the services. And so they now have their room within the library that has much more resources and has more staff time than was available at the initial table. I would strongly recommend from our findings that other libraries look at mental health as an additional service they can add to their spaces as they think about ways that they expand and evolve what a public library is. In terms of future research, though, I think more needs to be done to think about then how these systems connect to others. Because the one challenge with these types of sort of outreach programs is the risk around sort of episodic care. And so if the hub staff are not connected at all to primary care providers or hospital outpatient services, for example, then you might get some disjointed, disconnected, and even different types of care for the same individual. So going forward, I think this is a wonderful model, but we should also think about how the model integrates with the whole of the mental health system in our communities. So what was different about this work is that while libraries have expanded things like access to settlement services or language programs or social services like Ontario Works or social assistance programs, there had been some hesitancy around integrating healthcare. Because we know that healthcare services are so desperately needed, there was a real concern from the staff that folks would only be coming into the library to access this healthcare service and then leaving the library. They wouldn't be patrons of the library, they wouldn't become patrons of the library, that they would just be accessing this service. So it was a risk, it was a step out that the library took to allow the mental health service into the space, but it was one that proved rewarding in terms of allowing them primarily to support their patrons and to support their own staff in different ways of dealing with mental health crisis.